Hey everyone, it's Dr. Hodges, and I want to get in a little quick video in between patients. I was watching my Instagram, like me and a million other people do on a daily basis. And there's this really funny guy. I think he's like a male model, but he's also a cardiologist. He's really cute. And he does the funniest videos. I gotta find his handle. He does the funniest videos on cardiology. Um, and he was being interviewed by two ladies, and he was talking about GLP-1s and kind of breaking down information. And he was talking about the good outcomes that patients can have. And I think GLP-1s are great. I think they are a wonderful adjunct. I'm going to put my phone down. They are a wonderful adjunct to weight loss programs, and even if you've had weight loss surgery. But you know what really, really works? Surgery. I mean, surgery is 5 times faster, or not 5 times faster. It's like 5 times the amount of weight. And I bring this up because I just saw a patient. I operated on that patient in 2018. It is 2026. Okay, so let's do the math. I did her surgery 8 years ago. She had a duodenal switch. She has lost, I'm looking, 120 pounds, and she's kept all of that weight off. Right now, her BMI, I'm looking at the chart, is 24. That's a normal BMI. She looks great. She feels great. Her lowest weight was about 8 pounds lower than where she is now, and she's now like really evened off. But when we are looking at controlling weight, controlling health problems, giving people options, I find that usually people can lose on their own, whether they do medicine or whether they do a crash diet or they exercise. They can usually lose 10 to 15 pounds on their own. It becomes significantly more difficult for you to lose 120 pounds on your own. And the only thing that's consistently been able to do that is surgery. And so when you're looking at all of the options that are available to you, I really want to hammer home that it's not just about getting a lot of weight off, it's also the maintenance of that weight loss. And a duodenal switch is fantastic. So that's the biggest thing. There's so much chitter chatter online from your friends, family about GLP-1s, and you need to know that typically with the GLP-1, you're going to lose roughly 12 to 16. They tout 25%, but I think in real life, you're probably going to lose about 16%, up to 16% of your excess weight. What does that mean? That means if you are 100 pounds overweight, you're going to lose about 16 pounds. Compare that now to somebody that is going to undergo a duodenal switch. On average, they will lose 85% of their excess weight. So that means if you have 100 excess pounds, you will lose 85 pounds. Okay, so you're going to lose more weight with a surgery. So that's number one. Number two, now let's look at where the rubber meets the road. Again, it seems to be much more difficult, not just to get the weight off, but let's keep that weight off. Now let's look at the longevity of surgery versus medicine. With medicine, the recidivism rate, repeat offender. That means, what is the risk of you regaining back your weight? That's about 98%. What is the risk with the duodenal switch of regaining your weight? And regaining about 5%. And we have 30-year data. So the most successful surgery that we have on the market today is good old-fashioned duodenal switch, and not the Sadie, which is the one anastomosis, and not this, that, or the other. Like, sometimes you just got to go old, tried, and true, okay? Old school, laparoscopic, duodenal switch in a Roux-en-Y configuration. You're going to lose the most weight. And if you are seeing your doctor regularly, and yes, it can happen. I literally just saw my patient, and I've been seeing her for 8 years. You go see your doctor on a regular basis, and your doctor's checking your labs. We went over labs. Her lab looked great. You're doing the things you need to do about 80% of the time, and the other 20% you live your life. You know what's going to happen? You're going to have a pretty good outcome. So just a little food for thought. There's, again, so much talk about GLP-1s and what's the newest and the latest and greatest. And sometimes the best thing is the thing that's been around the longest. So just something to think about.